Welcome to the Mom is Fit YouTube channel. In this video, Roxanne and I are going to be talking about what we would include in our birth plans and why we would include that in our birth plan as birth workers. Now, it's important to note in this video, the things that we may want to include in our birth plan may or may not be what you would want to include in your birth plan. So please don't feel like everything that we said we would do must be what you do as well. Rather, we want you to hear our rationale behind why we would choose certain things for our birth plan to help you better make decisions that work best for you and your family. For those of you that don't know me, my name is Gina. I'm a birth doula and perinatal fitness trainer.
And I'm Roxanne. I'm a labor and delivery nurse for over 8 years and a student midwife.
So Roxanne, as a labor and delivery nurse and student midwife, what are some things that you included in your birth plans when you were giving birth in a hospital?
So one of the things that I included in my birth plan was that I wanted intermittent fetal monitoring versus the continuous fetal monitoring that is commonly the routine in a lot of hospitals. So continuous fetal monitoring are those monitors that they place on your belly at the top and the bottom to listen to baby's heart rate as well as monitor your contraction frequency, like when they're happening. Intermittent fetal monitoring is different, where they're going to just listen to your baby's heart rate before, during, and after a contraction for a shorter period of time, and you don't have any monitors attached to your belly. And research has shown that this is a very viable option and safe option for someone who has a low-risk pregnancy and something that I wanted to opt in for my pregnancies. It is important to discuss this option during your prenatal visits because you want to know, is this even an option that's offered at your hospital? Because not every hospital has the equipment or the experience to be able to do intermittent fetal monitoring. This is commonly the only monitoring option that they have in community births, so at freestanding birth centers or at home, to monitor baby's heart rate. With intermittent fetal monitoring, it's sometimes also called intermittent auscultation. This could be defined differently at the hospital that you're actually delivering at. Some people define it as they're just listening every 30 minutes to baby for a few seconds before, during, and after a contraction. Or other people define it as they're monitoring you on the monitor with those two monitors, one at the bottom, one at the top, for 10 to 20 minutes every hour. And then all the other times you're not connected to the monitor. So understanding the definition of intermittent fetal monitoring at your actual place of birth can be beneficial so that your expectations are met.
What are some reasons why you would choose that type of monitoring? Like, why did you choose that for your birth?
So intermittent fetal monitoring has benefits. One, you're not tied down or like on a leash, as some people will say, with continuous fetal monitoring. You have a lot more freedom of movement with intermittent fetal monitoring. And then just for me personally, knowing that like I'm not listening to baby's heart rate and potentially that could cause some anxiety associated with is baby's heart rate going up or down, just because I know so much about fetal monitoring in general could be a little bit interfering with my birth process. So that's why I chose intermittent fetal monitoring.
It can also be helpful to know what type of monitors are available for you at your birth location, because this could also change what your decisions are for how you would like to be monitored. If it's a stationary machine where it's corded and you have about a 6-foot leash, that may not be your preferred option. But if you do want to be continuously fetal monitored and they have wireless monitors or a portable monitor, that may be a great option for you. So understanding what's available at your birth location could be very beneficial to helping you decide what your preference is for this.
Another thing that I chose was to have an IV still placed, but have it saline locked. So this just means that it's not connected to IV fluids, but it's there just in case for emergencies. I did not get an IV with my first one, and that's kind of a preference, but also like I showed up at 10 centimeters ready to push a baby out, so there wasn't a lot of time. But with this most recent birth, I did decide in the moment that I wanted an IV place because I just had a feeling that I have a high risk for postpartum hemorrhage, and I thought maybe I might have some sort of hemorrhage. So having it there just in case it's needed gave me a little bit more peace of mind. But you always have the option to have it placed with that saline lock so it's not running. So bringing this up again in your prenatal visits, as well as you always have the option to have no IV, but discussing the risks versus benefits of not having IV access versus having at least a saline lock with your provider could be helpful to understand which one you truly would decide.
Something that I do find with my doula clients in regards to the IV port access or having IV fluids attached is some of them don't want an IV at all. Like they don't even want the saline lock placed. And it's important to note that this is not typically the routine of care. And so it can sometimes make the staff uncomfortable or a little like shocked in the moment when you tell them this for the first time in triage. So it can be really beneficial, like Roxanne said, to have a conversation during your prenatal appointments so you get a good gauge on like what to expect when that conversation happens. And this also gives the staff an opportunity to know that this is coming and that this is one of your preferences so they can adjust their care as needed.
And during my most recent birth, I did have in my birth plan that I did not want an IV. And my midwife even read my birth plan when we were getting admitted. And she's like, oh, actually, she doesn't want an IV, so let's not place one. But I had changed my mind again in the moment that I was like, I feel like I need it, so it's okay if it's placed. I did put my plan for pain relief for labor in my birth plan as well. I did obviously have an unmedicated birth, and that was my goal. So that was number one, was my first option for pain relief. I wanted to go unmedicated. So I wanted to not have any sort of pain relief. I wanted to ask for it if I wanted it. And that was like what I put in my birth plan. But if I did want pain relief, I then rated the options available to me. So if they have nitrous oxide, if they have IV pain relief, and then epidural, I rated which one I would like to try first before moving on to the next pain relief options. So rating which ones you would want can be helpful. So in the moment, if you decide, hey, I don't want to do this unmedicated, or hey, my plan at the beginning of all of this is that I would like an epidural, so everyone is aware like which one to try to get you first.
So it can be helpful to know what your pain relief preferences are when it comes to your birth, because this is how like the staff and your birth support team know how to support you. So if you're wanting an epidural as soon as possible or as soon as your labor starts to get challenging and your birth support team can recognize that you're starting to struggle a little bit with your contractions, they know to bring up the epidural to you right away to be like, hey, do you feel like this is a good time? Are you wanting to go unmedicated, or are you wanting that epidural still? And so this could be like a good opportunity for them to bring it up to you to remind you that this is an option, not that you will forget. I promise you that if you want an epidural, you'll remember that it is available to you. But it can be helpful to know like, hey, now is a good time for you to get it if you're wanting it. And then the opposite is also true. If you're wanting an unmedicated birth, it can be really frustrating and mentally challenging if someone is constantly bringing up pain relief to you. Or do you want an epidural? Let us know when you want your epidural. What are your pain levels at? And so if you're wanting an unmedicated birth, letting the staff know and your birth team know, hey, I know my pain relief options and I will ask for them when I want them, can be really helpful so that they know, hey, she's wanting a medicated birth. We're not going to keep it from her if she changes her mind, but we're going to help encourage her and push her, because we know that labor can be hard. There are certain points during labor where people sometimes start asking for help, and sometimes asking for help as a coping mechanism can be asking for an epidural. So you can have a plan established with your birth support team to let them know when you're serious about an epidural. But usually it's pretty obvious if somebody has changed their mind. Like, it's hard to miss when somebody is like, no, I'm opting out. I would no longer like to have an unmedicated birth. But it can be helpful for the team to know, hey, she wants to be pushed a little bit towards that unmedicated birth is something that's important to her. We're not going to bring up the epidural or pain relief options unless asked, versus she wants an epidural as soon as possible. Let's make sure like we can help support her in that. Can really help the staff support you to have the birth that you're wanting.
Another thing that I would include in my birth plan is what would I want for baby? Number one, I would learn what the routine was at my hospital. So I learned that they do skin to skin, and they do delayed cord clamping, and they do the uninterrupted 1 hour after birth. So I did not put that in my birth plan because they're going to do it regardless of if I put that in there or not. The things that I did include in my birth plan were things that were different from the normal. So we didn't choose to use eye ointment for our baby. So I put that we were not going to get eye ointment at birth. So like if there's different baby medications that you're not wanting, putting that on your birth plan, as well as if there's anything that's outside of the norm that the hospital did, that's what I would put in the birth plan. So we didn't get the eye ointment. That was a personal choice that we made based off of the reason that eye ointment is given is due to newborn pink eye that could develop and lead to newborn blindness, which is not preferred. But we now know in 2024 or 2023 at the time, that the reason for the newborn pink eye developing and then leading to subsequent blindness was due to sexually transmitted infections such as chlamydia, gonorrhea, and syphilis. And this is why all pregnancies are tested for these sexually transmitted infections during your pregnancy, sometimes multiple times during your pregnancy. So I would know if I had any of these illnesses prior to birth. So we opted not to give an antibiotic that she potentially didn't need, likely did not need since I was negative, and if there was other infections or bacteria that were there that could have caused a different type of newborn pink eye, erythromycin has not been proven to be effective over different bacteria aside from sexually transmitted infections. So that was the choice that we made not to get the eye ointment. But some people might choose to get the eye ointment. The vitamin K is the other medication that they'll give. And then the hepatitis B vaccine, the first shot of the 3-shot series, is also offered at birth. We did have to sign a consent form that we declined the eye ointment, and you just sign in and they put it in your chart because it is still like the normal routine for newborn medications, but you always have the right to say no to any of them. So Gina is delivering at home with this baby, but what are things that you would include in your birth plan if you were either going to deliver at a hospital or deliver at home?
So the reasons that I would be delivering in a hospital because my plan is to give birth at home is because there's a complication with my pregnancy that no longer makes it safe for me to be at home. So the things that I would be including in my birth plan would probably include things about being induced for my labor because there's a complication that is making me risk out of home birth, which likely means that I'm needing an induction of labor. I would have to decide what my preferences would be along the induction timeline. And now when you're being induced, it's just until it gets you into active labor. So you don't need to do every single step of an induction. But there are some certain points where you can kind of like choose your adventure of which path you want to take, like AROM or artificial rupture of membranes, or starting Pitocin. For me personally, I would start Pitocin before I had my water broken because Pitocin I could always turn off. If like my baby's not tolerating it, if I'm just like loving this experience, I could always turn it down, or not me personally. My nurse can turn it down or turn it off.
Just turn it off.
I am unplugging the machine. Goodbye. While with my water being broken, I can't reattach my bag of water. Like once it's broken, it's broken. Now they can put more fluid in to help as needed, but it feels more permanent to me than like Pitocin, where I have the opportunity to turn it off and then it's out of my system in a certain amount of time versus like AROM, like it's going to just be that way.
No going back.
There's no going back from that. In addition, with artificial rupture membranes, the longer your water is broken, the higher risk of infection as well. And so I don't know if the AROM is going to really kickstart things as well. While if Pitocin isn't working, we could always just turn it off. I could take a break and then allow my body to kind of rest. And I'm not necessarily increasing my risk of infection by taking a sleep, taking a little bit of a nap, and then restarting the Pitocin. While if nothing's happening with AROM and I'm like, I'm just going to chill, I'm just increasing the timeline of how long until an infection starts. So that's my preference between the two. Now, if I was in a birth location that did not have a portable monitor option, like a portable or wireless monitor, I may opt for AROM over Pitocin because Pitocin, you usually have to be continuously monitored. And so I would probably only opt for that if I knew I can move around freely because my goal is usually an unmedicated birth. And it's going to be really important to me to be able to use a shower and use the tub and move around my room. But I can't do that if I'm attached to a machine. So if my option was to be attached to this machine with Pitocin or have my water broken and be able to freely move around the room, I would probably opt to have my water broken. So that would be a consideration that I would make in that scenario, depending on the type of monitors that were available. However, in the hospitals that I would be giving birth at, they have portable monitors or wireless monitors. So I would likely choose Pitocin if I had to choose between the two.
So I hope this video kind of helps you understand why people might make certain choices for their birth plan and the rationale behind it. If you make different choices during your birth planning process, comment them below and let us know why you chose them.
So thank you so much for watching this video. Hopefully it helped you understand why we chose certain things to help you better make your own decisions that work best for you and your family. If you enjoyed this video, be sure to like and subscribe to our channel so that you get notified whenever we release new videos. We release 1 to 2 new workout videos a week and 1 educational video every week. If you want more support throughout your pregnancy so that you can understand what all of your options are for birth and what are some different reasons why some folks may choose one thing versus the other so that you can figure out what the best option is for you, you can join our online childbirth education course. And as a thank you for watching this video, you can use code YouTube10 to get 10% off our online course.